So we wanted to know about how you first experienced cancer and when that happened.
Okay, so yes, I was 5 years old when my sister got diagnosed with brain tumor, and I remember I didn't know much apart from what I saw in movies, and that was kind of scary. So I did not have much knowledge at all, and so one good thing was I think my parents would talk to me often and let me know what's going on, so that really helped. So I was anxious. I remember praying a lot, and I remember hoping that she'll be fine, because the general uh, knowledge around cancer was that people don't survive. Um, and so, as a kid, I try to make sense of it as best as possible. Um, but yeah, it helped that my parents told me, oh, she needs to undergo a surgery, and whenever she had a surgery, I was with my aunt, so there were people taking care of me, and trying to tell me as much as I could understand and as much as they felt was safe for me to know. Um, so yeah, that's the first time I heard about it or experienced it closely. And yeah,
So you did go on to lose your sister
yes,
at a very
yes.
early age, and then how did that loss affect you in the years to come?
Um, so like I said, there are a few things I feel like my parents and my family did that kind of protected me, in the sense that I was involved in a lot of discussions, because they would talk around me, but they would be mindful of how I understood it. And so they would tell me that there are these surgeries that are going to happen. And so she had the tumor around the area, and it affected her optic nerve, so she kind of lost her sight, which was very painful for me to even know and be around. um, and so we would try our best to work around it. So there are a few things that really helped during and even after. So one of the things that we would do is, my sister constantly needed music, so we would have to play the music all the time. And during that time, there used to be power cuts, and so you had to sing when there was no music. And so we would sing to her a lot. Um, and so just to let her know, you're not alone, we are here. And I think that really helped me, because that was one of the ways, now looking back, I felt like I was able to let out what I was feeling. So no, no, now the kind of things I know in terms of like trauma and how it's processed and grief, those were some of the things that I felt like really helped me. Um, the music, the songs, the family time together, knowing what's going on, knowing what to expect next helped. But one of the things that happened was the doctors had kind of given hope that maybe surgically or with radiation it would get better, but that didn't happen. So even for me, like, the loss was kind of a shock, because I was really hoping she's going to get better. And so immediately it was not very great. I remember that, like, the next day after she passed away, the day that was supposed to be the funeral and the burial, I remember I got an intense stomach ache. Like, I was howling with pain. And I guess that was, my psychosomatic way of reacting to that. But I just remember having that. Um, and I think one of the ways I dealt with it was, uh, I spoke about it in whatever way, to my friends. And we were all like in third or fourth standard, but I had good friends, I guess. They would ask me about how I'm doing. And so I would talk about my sister. I would say, I remember this, we used to do this and we used to do that. Because the sense I was getting at home was if I speak about it, it would cause pain. So I didn't much speak about it at home. It would have helped, I guess, but then I spoke about it with my friends. And so the thing, my observation, and my parents may have a very different understanding of it, is it affected different people in my family, like my mom, my dad, and myself, very differently. So as a result of the treatment and the stress and the anxiety around, how my sister was doing, my mom developed high blood pressure at the age of 35, which is really young. And, I remember at that time knowing that she would have to take some kind of medication for the rest of her life, or most part of her life. That was something that she had to really deal with. And my dad, I think this is my understanding again, he has had a hearing loss over the years, and I feel like it spiked after the loss of my sister. So I feel like it affected him that way, more so because I feel like he kind of pulled inside, and he was mostly by himself, and so he was just so preoccupied that even when someone was talking to him, he wasn't really listening. And it kind of worsened that, inability to hear a little bit. So but I feel like how it inspired me in other ways is, I remember when I was a kid, I was like, I wanted to become a doctor or a neurophysician or a neurosurgeon. That didn't happen clearly, but I feel like that those experiences that I had, where it really would have helped to have someone to talk to, or if my parents had some sort of support. Of course, I think my family was a major support in terms of taking care of me and providing some sort of support to them, financially, emotionally, or otherwise. But I really feel like if they had someone to talk to and address the concerns around cancer, because I know that they had so many questions, but doctors wouldn't answer them. So my dad was working in a hospital setting, and so he was able to go and talk to just one person and say, hey, I really need to know what's going on. Seems like the doctors are trying to protect us, or trying to not get us to panic, but it's not really helping. We really need to know what's happening. And so I don't remember exactly what he said, but he probably told them, look, these are the risks, and these are the factors that might help. And that really helped. Just that one piece of information really helped. But if they had some more information, or if they had a counselor or just someone else talking to them, giving them more information, would have really helped.